guys, and welcome to another Whitney's Wonders. So today I have a health update for you. So after my last health update, um, in regards to my foot, so let me take you back actually. So in January of 2022, my left foot started to swell. Kind of just ignored it, didn't know what it was about. I've had my foot swell before, and then I just elevate it, ice it, whatever, and it goes away. So this time it really wasn't going away. And I was having troubles at work. I still went to work, but it was getting hard to walk around. It was really painful. I would swell. And then all of a sudden in March of 2022, these things that looked like bruises started showing up on the side of my foot. Now, if you watched my last health update, I kind of like put the camera on it so you could see it. But it hasn't gotten better since then. It's taking its sweet butt time healing. I saw my rheumatologist, I've seen my gastroenterologist, I've seen them all. So they have called it Pyroderma Gangrenosum. At first they thought it was erythema nodosum, which is just when you get red patches on your legs. The Pyroderma Gangrenosum is when you get those things, but they start like ulcerating, ulcers basically. So it has been a ride for me. I've been off work currently just because honestly, like if I don't have it elevated after an hour or two of being on it or sitting, it starts swelling. These things on the side, my rheumatologist says they look like they're healing. It's just very slow. It was a big hole that had to heal, so it's kind of like scabbed out huge. I haven't decided if I'm going to include the latest picture of what it looks like in this video or not. We'll see. I probably will, just so people can get an idea of what this stuff kind of looks like. But so I was off the steroids and feeling okay. I've been on steroids on and off since September. So I mean, I'm about ready to be done with them. I'm done with the side effects. Yes, they did give me great energy before. I don't have the energy left anymore because now my body's trying to heal this stupid foot. But I mean, I've had pretty much every side effect of prednisone and I'm ready to be done with it. So I was done with it. And then my rheumatologist said the only way to combat this on your foot is to go back on steroids. So I was back on steroids. So now we're at the part where I actually just had a flex scope done today. So what a flex scope is it's not a full colonoscopy. They don't do the full colon and look at it. He just wanted to look and see if my new medication Entyvio was doing anything. So I'm on Entyvio and Cimzia at the same time right now. I highly doubt I'll be on them together for a very long time because we'll see what his results said today. I know he said he had like 3 biopsies he pulled, so we'll see if that's just polyps or whatever. So hopefully there's nothing else wrong in there. I've had them pulled before. There's usually nothing. It's just I'm happy that he gets them out before they turn into anything. So of anything, the positive side of Crohn's disease is that you have so many colonoscopies and early prevention that if anything else becomes something, you're going to catch it really early, which kind of makes me feel a lot better, but it still sucks. So the flex, I get sedation with it. Some people don't, but I'm not going to get that kind of stuff done without sedation. I'm sorry. So, you know, like usual, props to my mama. She drove me there and picked me up. He was running a bit behind today, but he was looking around, so we'll see because if the Entyvio and the Cimzia aren't actually doing anything, this is probably why this other stuff is popping up. So they said it's an autoimmune response. So it's responding to something's happening in my body where now it's having other things happen to it. So if the meds aren't working and disease is kind of running rampant and inflammation is going on, then these other things are going to happen to me. So that's the best I can describe it. That's how I know it. I know I get a lot of family members, friends ask me, what is it? What does this mean? What does this mean? I don't know the full extent of things. Again, most of the doctors have, like even when I go in for things and nurses look at it, they have so much they need to know in their certain fields that they can't know everything. That's like all of us, right? So just slowly waiting for that to heal whenever it decides to. So I think it is. I think it's getting better. It's just taking its time. My rheumatologist said some people have dealt with this for years, months, whatever. So I'm just going to chalk this up to, because there was a while there where I was getting abscesses and I haven't got one in a while. So I'm just going to chalk this up to I'm dealing with this right now. It's going to go away and hopefully never come back. Because like everything else that I get, it comes, I deal with it, I take whatever I need to do for it, and then I move on, and it's a past chapter in my life, and I continue on smiling. That's what I like to do, because I'm not going to let this crap beat me. There's no way. There's no way I will let it beat me. But so hopefully everything's going okay at work. I've been off, but I've been relaxing. I've been keeping my leg up. My mom has been over helping me all the time, not only inside, outside the house. So basically from there, we're going to see. I got to wait for these tests. Now, my rheumatologist doctor, she wanted to have the discussion about a medication that's called methotrexate. Now, what scares me about the methotrexate, because I've been on these kind of pills, the higher higher pills like the Imurans, which gave me pancreatitis for one. So, one, I'm already hesitant to take this medication because I know I'll probably get the side effects. That's just the way my body goes. But Dr. Pavlova also told me that if I'm on methotrexate, I'll have to go on birth control or abstinence or condoms because you can't get pregnant while you're on methotrexate. Now, here's the thing, ladies and gents. I have never been huge. I mean, at first I said I wasn't going to get married. And then I married Kyle because I met the man of my dreams. But yeah, so, and then I always was really against having children. But now when they kind of like throw it in your face, I'm already 35, so I'm not getting any younger, right? So when they kind of say like at this point, if you're going to be on methotrexate and you can't have children, it's kind of throwing it right in my face. So I have some decisions to make about what I want to go doing moving forward. I'm kind of hesitant to do the methotrexate anyway because it's kind of like a scary drug to me. So I've kind of said no. So I'm going to see what all these results are from testing this and that. There's also another med I could try if I go off both of these. My rheumatologist is hesitant to take me off the Cimzia when I'm on because she doesn't want my spine to deteriorate more. Because with ankylosing spondylitis, your cartilage through your spine depletes and then it's bone on bone, and that's why I've started, with the hunchback with the neck and stuff. So I don't want that to get worse. So, I mean, at this point, I've got some thinking to do. I've got some plans I need to make. I don't know. So that's a bit of the health update. I mean, it's funny when you watch back how excited I was on the prednisone and how, it was making me feel. And now, like, maybe it's some of the prednisone causing this. I don't know. So I just need to get to a good level, see where I can go from here, and hopefully things will get better. So hopefully at my next update, I will be able to give you guys some information about what Dr. Jones tells me from my scope today and what he thinks. I was kind of awake for a little bit of it, so I looked at the screen because it's right in front of you. I mean, it looked pink, so it looked like it was good. I don't know what a healthy colon or whatever part he was in is supposed to look like. I figured nice and pink like skin, but we'll see what he says. So I just wanted to hop on and give you guys a quick update of what's been going on. This is what I've been dealing with going forward, what the plan is, and hopefully we have some good news after this one. So thanks for watching, guys. I love that you follow me on my health journey. Thank you for being a part of my team, my life, my support system, everything moving forward. And just let it heal, get better, take care of myself. Everybody tells me that, just take care of yourself. And you know what? At 35, I finally decided that I'm not going to feel guilty about these things. I'm going to be a little selfish. I'm going to take time for me because that's what I have to do with autoimmune. And if you don't have autoimmune, you don't know. And I'm not saying that to be mean to anybody, but if you do not wake up in chronic pain every day, you do not know what it feels like. Sure, there's some times where little things happen where we're sick, but like people just don't understand that. They say, oh, you're still doing it, you're still... Yes, these things don't just heal in perfect time when you have healthy people. I'm not a healthy person. I haven't been for a very long time, and I probably never will be because of this stuff. So I get it. It's frustrating. Imagine being the person who actually it's frustrating for in the body. But for some reason, people really need to care what other people do. You see it in today's world, too, with everything. Like, everybody's got an opinion. Oh, you shouldn't do this. You should do that. I just smile and nod and say, okay, I'll do it, and then do what I want anyway. If those of you who know me, especially probably Mom, she's probably watching this right now going, yes, she's stubborn. Yeah, that's what she does. So, I mean, I don't want to sound like a biatch about it, but yeah, if you don't know, it's like same with anything else. If you haven't been through things, you can't really comment on, you don't know what it feels like, and unless you get it, and I pray that you never do, because it's a lot of crap to deal with, to be honest with you. But like I said, you pull through. Put a smile on your face. This is what I do anyway. Everybody deals differently. I'm not telling anybody how to do their plans. Put a smile on your face, move forward, and you just keep beating it because we have a very good medical system. So guys, that was another health update. Hope you enjoyed it. And I should have one coming out again shortly after this one, just saying what happened during the scope and everything. Okay? Guys, take it easy. Till the next one, take care. Mwah.